Madam Speaker, 2 men in Halifax recently died after being tased when police were the only service available to respond to mental health crises. HRM Council recently approved the creation of a mental health crisis response team, which is a step to better safety and outcomes for people living with mental illness. This is an evidence-based approach that is in place across Canada and around the world, long called for by clinicians, police, and people living with mental health issues. Why won't this government commit to funding mental health crisis teams across the province now so all Nova Scotians can get the right help when they need it?
I recognize the Honourable Minister of Addictions and Mental Health.
Thank you, Madam Speaker, and thank the member for this important question. That was certainly a tragic incident that she's referring to, so I can't comment directly to those. I would say we're doing important work right now with the first pilot with a community-led crisis response model in Windsor. We've done significant work with different policing agencies across the province in terms of crisis interventions training. Specifically in Central Zone, there's a number of new services for acute mental health distress, acute mental health day hospitals, recovery support centres. So we're doing everything we can to increase care. We certainly have some ongoing conversations with HRM, and we'll continue to have those. Thank you, Madam Speaker.
I recognize the Honourable Member for Halifax Citadel Sable Island.
Madam Speaker, pilot projects are important when you need to provide proof of concept, but mental health crisis teams have a body of national and international evidence that we can use. There's no question that the model works. There's other evidence that we aren't using in Nova Scotia for patient safety and better outcomes. For instance, this government's universal mental health program ignores existing models that center patient safety and deliver high-quality evidence-based care in a universal model. Will the minister commit to implementing patient safety measures in the universal mental health program starting April 1st?
I recognize the Honourable Minister of Addictions and Mental Health.
Thank you, Madam Speaker. I would say, I've had the opportunity to speak to many of our clinicians across the province over the last several years. They use evidence-based practice, patient-centered care, always involve the family to the best of their ability. To say that our clinicians don't use evidence-based care, I wouldn't agree with that. I think they do a fantastic job. There's certainly always more that we can do, especially in terms of crisis response. And I think, with the pilots we're doing, with our commitment to universal access, it's really sending a message that we can always do more, but we're really doing everything that we can. Thank you, Madam Speaker.